पेन किसी भी तरह का हो, whether it is a headache, back pain or joint pain, it doesn't feel good. It pulls you down, you're not able to focus on work, it just takes over your day. If this is the case, if you know that I'm right, then watch this video till the end. I have some specific solutions for you which can help you get rid of your pain effectively and quickly. In my 20 years of practice as a sports physiotherapist, I have seen a lot of pain issues, all kinds of pain issues, and varying degrees of pain. So, what I have found is that pain can be prevented, absolutely prevented, if you take care of it from the beginning. You can manage it really fast. The longer that you let pain go, the more chronic it becomes, which means that it has been 3 months, 6 months. It's much more difficult to reverse this pain now if it can be reversed. So I urge you to take care of your pain right away. I have written a book, an ebook about this topic. If you would like to check that out, then I have put a link below. You can click on that link and get the book in your email. In this video, I want to show you 3 specific steps of how to take care of your pain quickly. The first step is to understand your pain. Unless you know what kind of pain you have, you won't exactly know how to treat it. The second step is to understand the difference between treating your pain yourself or seeing a medical professional. The third step is the solution itself. What are you doing right? What are you doing wrong in order to take care of your pain? So step number 1, knowing your pain. What kind of pain do you have? The first thing to do is to score your pain. What do I mean by that? On the VAS scale, a visual analog scale from 0 to 10. If 0 was no pain and 10 was you would have to be hospitalized right now, I want to put a number to your pain. The second thing you want to know about your pain is whether it is acute, subacute or chronic. So acute pain is something that has just started. Maybe it's been about 24 to 48 hours. Subacute pain is 2 दिन के बाद, say maybe a week, 10 days, 2 weeks. After 2 weeks, it goes into the subacute chronic stage. At this point, it's very difficult to get real solutions. If it is chronic, then you definitely need to see a physician, a medical professional to take care of your pain. If not, if you feel that your pain is acute or subacute, then the exact solutions that I'm giving you in this video will help you. The third thing about your pain that you need to know, the pain is local, which means एक जगह पे है, or whether the pain is traveling or moving. So if it is local pain, which means कि pain सिर्फ एक जगह पे है, ज़्यादा move नहीं होता है, vary नहीं होता है, then this is called localized pain. अगर ये pain move होता है, for example, lot of people neck pain भी हो रहा है, साथ में थोड़ा आर्म भी दुख रहा है, पूरा हाथ तक भी दुख रहा है. Okay, this is pain that is called as radiating pain or referred pain. If it is moving pain, if it is traveling pain, then again you need to see a medical professional immediately, because this means that there could be some kind of nerve involvement. For this, you don't want to treat by yourself, you definitely want to see someone. But if the pain is localized and if it is acute or subacute, then you can definitely treat by yourself. So my solution number 1 to you, always go with an ice pack. Okay, now most of the time ice works better than a hot pack. I would go as far as saying that 80-90% of the time ice will do the job, especially if you do frequently enough and if you do it the right way. People ice, but they don't do it the right way. So I've made a video on that, you can check that out. Do ice the right way and see the results. The solution number 2 is to make sure that you are giving yourself some kind of rest. I'm not talking about bed rest. It depends on your VAS scale. If your pain scale is really high, more than a 5 or 6, you need to go see a doctor, right? But if it is anything below that, then you can put ice on it and then rest it out, which means that you can stop doing those things that make the pain worse. Let's take an example. If you're a runner, every time you go out to run, you have knee pain. So just take a break from running for a few days while you're treating it on your own, and that should help. Point number 3 is to do some kind of gentle movements. पेन यूजुअली रेस्ट से रिस्पॉन्ड करता है in the beginning, but sometimes we also need to give some kind of gentle movement along the joint, along the back, but understanding the right movement or exercise is important. अगर आप योगा करते हैं और आपको लगता है कि फॉरवर्ड बेंडिंग में जब भी हम करते हैं तो पेन बढ़ता है, मे बी अवॉइड द फॉरवर्ड बेंडिंग एंड डू मोर बैकवर्ड बेंडिंग एंड सी फॉर अ फ्यू डेज हाउ दैट फील्स. बहुत बार पेन इसलिए ठीक नहीं होता क्योंकि सही चीज़ों को करने के साथ साथ हम गलत चीज़ भी करते हैं. फॉर एग्जाम्पल यूजिंग अ हॉट पैक एट द बिगिनिंग. जैसे मैंने आपको एक्सप्लेन किया, आइस पैक इज़ वेरी सेफ टू डू. स्पेशली फर्स्ट वीक के अंदर अगर आप आइस पैक करते हैं, स्पेशली इन द फर्स्ट 48 आवर्स, तो उसका रिलीफ, उसका फ़र्क आपको बहुत जल्दी समझ में आएगा. अगर आप उस वक्त पे हॉट पैक करते हैं तो दिस कैन एक्चुअली बैकफायर. द सेकेंड मिस्टेक पीपल मेक इज़ दूसरों लोगों से कंपेयर करते हैं. फॉर एग्जाम्पल, अगर किसी और को बैक पेन है तो उसका सोल्यूशन सेम नहीं होगा जैसे आपका सोल्यूशन अलग हो. एवरीबडीज बॉडी इज डिफरेंट, यू आर डिफरेंट फ्रॉम योर फैमिली मेम्बर, फ्रॉम योर सिबलिंग, राइट? सो यू नीड टू गेट द सोल्यूशन दैट्स राइट फॉर यू. थर्ड मिस्टेक जो लोग करते हैं, मूवमेंट कंप्लीटली बंद कर देते हैं. मतलब उन्हें लगता है कि 100% बेड रेस्ट करो या ये कंप्लीटली छोड़ दो. दिस इज ऑल्सो नॉट द सोल्यूशन. ओनली रेस्ट इज नॉट गोइंग टू हेल्प. डूइंग ए कॉम्बिनेशन ऑफ आइस पैक with gentle stretching is going to make the biggest difference. Try these techniques and strategies that I have given you. If they don't work or if you feel that you've already tried some of these things, feel free to get in touch with me. अगर ये वीडियो आपको यूजफुल लगी तो प्लीज़ अपने फ्रेंड्स, फैमिली मेम्बर्स से शेयर करिएगा. And don't forget to subscribe to my channel. Every week I post a lot of useful tips for pain, for running, for cycling, for any kind of pain management. There are a lot of tips coming your way. Thank you for watching. I will see you in the next video.